So partial, I will tell you the plan.
Yes.
Okay.
Yes.
Each and every quadrant I will tell you. You can note it down. So lower one incisor,
Okay.
one implant.
One implant.
Two incisor, one implant.
One implant. Two incisors.
One implant.
Okay.
See,
Cantilever.
Yes, you can give cantilever. See, the root is very small
Yes.
and the roots are very close to each other.
Okay.
2 inches. If you place one implant and if you extract and place one implant, they will be touching to each other very much.
Yes.
So place only one. This is the only area where you can place one implant and give two teeth.
Two teeth. Okay.
Give one cantilever.
Lower incisors.
Lower incisor. 3 incisors. What is your plan?
Two.
Two is enough. Can you place 3? Can you place 3 here? 1, 2, 3.
No.
They'll be touching to each other. You will end up in failure.
Yes.
4 incisors.
Two.
Yeah.
Two.
Here one. Here one. If you place one here, it will become close to that one. If you place one here, it will become close to that one. It is difficult to place. Even if you place, because the lower incisors they will be crowded.
Okay.
So many times, almost 99% we place 2 implants only. 4 incisors also. Whenever we try to place 3 implants, no, for 4 incisors, it ends up in failure.
2 implants.
If you have placed 3 implants and it is working, that means we are lucky somehow.
Yes.
Okay. So, but 2 implants is more than enough. Imagine canine to canine.
3 implants.
3 implant is more than enough.
Yes.
It was
canine one.
Yes, canine one, central one. Yes. If you try to place another one, it will become close to any other implant.